So today's question is, can you explain BFRB? I can. Body-focused repetitive behaviors, that's BFRB, and it refers to a group of related behavioral disorders which are characterized by uncontrollable urges like biting, picking, and pulling, and it can cause damage. The thing is, as many as 1 in 20 people, believe it or not, have some kind of BFRP, but in practice, they're often wrongly dismissed just as bad habits. In fact, what are generally complex psychological disorders result in people regularly causing physical damage to themselves. Now, BFRBs are characterized by the inability to control compulsively damaging impulses. And one of the most common is hair pulling disorder, where people pull out the hair not only from their head, but even from their eyelashes and other parts of their bodies, their arms, their legs, so on and so forth, resulting in visible bald patches. And this is called trichotillomania, or Trich for short. Patients often swallow their hair as well. Skin picking disorder is another common one, which causes people to repetitively rub or scratch or dig into their skin. And this results in scarring and sometimes in severe tissue damage. And in some cases, some really severe cases, there was one case I think it was in Australia, which resulted in extreme disfigurement. She had all of her limbs amputated because of it. And of course, I can't remember the case, but it was horrifying. And of course, one of the best known BFRBs is nail biting disorder, or onychophagia, to give it its real name, where people bite their nails to the point of chewing on the cuticles until they bleed. And I suppose, whilst the exact causes of BFRBs remain completely unknown, there are investigations into various potential emotional variables, as well as possible genetic component links. What we do know, though, is that some patients have reported various triggers for their behavior, such as, skin picking being in a response to a skin aberration, such as a scab or an ingrown hair, where they start off with small pickings and then it just becomes more and more and much bigger. And in most cases, though, these behaviors happen impulsively without any conscious decision to do so, which distinguishes it from OCD and therefore makes it even more difficult to characterize. And of course, the goal of characterization would be to figure out how to treat these disorders. And if a sufferer is more compulsive or focused in their behavior, you would treat that person with interventions that address thoughts or beliefs and the emotional aspects, such as anxiety, for example. On the other hand, if the pulling and picking is more impulsive or automatic, then interventions would aim to address environmental cues and impulse control strategies, things like that. The main difficulty, though, is that most people do not fit neatly into one category or the other, and this, of course, complicates treatment hugely. And therefore, therapists have to be very mindful not to make assumptions about what the driving force is in any particular case of BFRB. So yes, an interesting topic. How many of you bite your nails? Anybody? Let me know in the comments.